If you're a parent or a caregiver, you know that feeling. When your child is sick, it can be just so stressful. And pediatric diarrhea, it's one of the most common things you'll face, and honestly, it can be pretty worrying. So in this explainer, we're going to walk through a clear, calm guide to understand what's going on, what to look for, and exactly what you need to do.
So here's our game plan. We're going to break it all down into 5 simple parts. First, what even is pediatric diarrhea? Then, we'll get into the common causes. After that, and this is a big one, we'll talk about the real danger, dehydration. Then, we'll give you a solid action plan, your playbook, and we'll wrap up with the best defense, prevention. By the end of this, you're going to feel so much more confident.
All right, first things first. Let's get on the same page about what we're actually talking about here. Because when we say a child has diarrhea, it's not always what you might think, especially when you're dealing with a baby.
So the official clinical definition is pretty simple: 3 or more loose or watery stools in a day. But, and this is super important for infants, it can also just be a noticeable increase in how often they're going, plus a change in what it looks like. It really all comes down to knowing what's normal for your kid, because trust me, it can vary a lot.
And speaking of normal, this slide right here, this clears up so much confusion for new parents. You see that? For a breastfed baby, having 5, even 8 loose stools a day can be totally 100% normal. That is not diarrhea. But a formula-fed baby, their normal is completely different. See? Context is everything.
Okay, so now we know what we're looking for. The next big question is, why? Why does this happen? Let's unpack the most common reasons.
By far, the #1 cause is a viral infection, something like rotavirus. Most of the time, that's what you're up against. But of course, you've also got bacterial or parasitic infections, and even things that aren't infections at all, like a reaction to antibiotics or maybe a food allergy.
So this slide lays out the things that can increase the risk. Now, some of these are pretty obvious, right? Contaminated food, poor hygiene, that makes sense. But it's also really important to see the flip side, the incredible protective role of breastfeeding, which gives a baby so many crucial antibodies. We're definitely going to come back to that.
Okay, everybody listen up, because this is the most important part of this whole explainer. The real danger with diarrhea isn't the messy diapers. It's the rapid loss of water and electrolytes, those essential minerals our bodies need to work, which leads to dehydration. This is the one thing you absolutely have to keep your eye on.
You know, dehydration doesn't just hit you all at once. It's a progression. It can start out pretty mild, but it can get serious fast. Just look at how the symptoms change as we go from moderate, thirst, being irritable, maybe sunken eyes, to severe, where a child gets really tired or lethargic, has a dry mouth, and, this is a big one, doesn't produce tears when they cry. Those are major red flags.
And this is what the pros use. This is the official scale from the World Health Organization that doctors and nurses are trained to look for. And you can see the huge differences. With some dehydration, a child is thirsty, eager to drink. With severe dehydration, they might be unable to drink at all. That skin pinch test, that's another key clinical sign they use to see how quickly the skin bounces back.
Now, trying to remember all those clinical signs when you're stressed out and worried, that's tough. So there's a fantastic, really simple memory trick that you can use at home to figure out what's going on, and fast.
The first part of the acronym is DRY. Simple enough, right? D is for a dry mouth or tongue. R is for reduced urine. Think way fewer wet diapers than usual. And Y is for sunken eyes. These first 3 are really powerful signs you can spot just by looking at your child.
And the second part is baby. B is for body weight loss. A is for absent tears when they cry. The second B is for a sunken fontanelle. That's the soft spot on a baby's head. And finally, Y is for yawning, or that extreme sleepiness we call lethargy. If you're starting to see a mix of these dry baby signs, that is your signal. It is time to get medical help right away.
Okay, so you know the signs of dehydration. That's great, but what do you actually do about it? Let's dive into the practical, step-by-step management playbook for caregivers. This is your action plan.
The single most important tool in your toolkit is something called oral rehydration solution, or ORS. Now, this isn't just water, and it's not a sports drink. It is a specific, scientifically perfect mix of glucose and electrolytes. The sugar and salt work together to help the body absorb water way more efficiently, replacing exactly what's being lost. It's amazing stuff.
So if you're not seeing any signs of dehydration, you're on Plan A. This is your home care plan. The whole goal here is prevention. You just give a little bit of ORS after every loose stool to stay ahead of things. And
This is so important, you keep feeding them their normal diet, whether that's breast milk or regular food.
Now, if you do start to see signs of some dehydration, remember our dry baby acronym, it's time for Plan B. And this means a trip to a clinic or the doctor. They're going to supervise the rehydration, giving a really specific dose of ORS over about 4 hours to get things back on track safely.
And finally, there's Plan C. This is for severe dehydration. And let me be perfectly clear, this is a medical emergency. At this point, a child is often just too weak or tired to drink, so ORS isn't going to cut it. They need immediate IV fluids in a hospital setting. Recognizing the signs and acting fast is what matters most here.
While you're managing hydration, you've also got to think about food. You know, the old advice was to stop all food, but we now know that is absolutely wrong. Keep breastfeeding or giving formula. For older kids, you want to offer bland, easy-to-digest foods like bananas or rice. And what you for sure want to avoid are sugary drinks, sodas, and junk food. They can actually make the diarrhea worse.
So what happens if you can't get to a pharmacy for one of those ORS packets? Well, this slide shows just how easy it is to make a version at home. All you need is 1 liter of clean water, 6 level teaspoons of sugar, and a half a level teaspoon of salt. That simple recipe can literally be a lifesaver.
All right, we've covered how to manage diarrhea once it starts, but you know what's even better? Preventing it from ever happening in the first place. So let's wrap this up by looking at the best defense.
Here they are, the top 5 proven strategies. You've got your basics: hand washing, clean water, and proper sanitation. Those are the foundation. Then you have the rotavirus vaccine, which is a powerhouse against the most common cause. And that first item on the list? Exclusive breastfeeding? Well, that is arguably the single biggest weapon you have in your arsenal.
So after all of this, from the causes to the treatments, it all kind of boils down to this one final question. What is the single most powerful thing a caregiver can do to protect their baby?
And the answer is just so clear and is backed by so much science. Exclusive breastfeeding for the first 6 months. It gives them antibodies, it's perfect nutrition, and it has this profound protective effect that builds a strong immune system. It's really nature's ultimate prevention plan. By knowing the signs, having a plan, and focusing on prevention, you can handle this with total confidence.